My name is Dr. Joyce St. John, Chief Medical Officer, Barbados. The Safe Hospitals initiative is welcome in Barbados because we have a culture and a history of disaster preparedness and getting persons ready for response in Barbados. So the Safe Hospitals initiative has worked very well into our own program. In fact, because of the credibility that PAHO has with the government of Barbados, it has allowed us to get more leverage to ensure that we get funding for retrofitting of facilities, and also for the new build that we are working on for a new polyclinic in St. John. We have also indicated that we would want the Safe Hospitals principles infused into that new build. In Barbados, we have a central level ministry focal point, and the focal point at the one hospital, at Queen Elizabeth Hospital, is actively working through a multi-sectoral disaster preparedness committee to see about implementing the recommendations from the assessment that has been done at the Queen Elizabeth Hospital. And in our smaller facilities, the polyclinics, we have also been retrofitting, and we're quite proud of them having water tanks and generators so that they function after a disaster. And our latest implementation is putting in place radio communication so that the central level ministry can communicate with the facilities after disaster. A very important tool, the legislation comes into effect today, and we have had a countdown for the last 6 weeks where we've been doing public service announcements, and actually our health promotion unit has been going to key stakeholders like persons in tourism, the police. I went and spoke with the police commissioner about this because they're part of our enforcement aspect of the ban. The ban is for public places, enclosed, partially enclosed. There will be no smoking. And we're quite proud of it as part of the tool because, you know, our chronic disease burden is very, very heavy. And it's not only heavy in terms of the persons with disease, but it's also heavy in terms of the effects on productivity in that very important age group. And it's also important in terms of the actual dollars that we spend. 60% of the drug service budget is spent on chronic diseases, and that budget has ranged from 10 million US to 35 million US in the past decade. So that will give you an indication of the kind of money and the personnel that go into it. So no smoking is very important in our fight. It's, I think, the most tangible aspect of healthy public policy to support our chronic disease fight, apart from the increase in duties and the 100% tax on cigarettes. There's one other thing that we're doing with chronic disease, and then I can do maternal and child if you want. The chief medical officers of the Caribbean have been working on a policy. The policy is for the renewal of primary care and also for the infusion of primary care philosophies into the way that we do our public health business generally. And the whole idea behind it is for us to maximize our health systems and get them responsive to not just chronic disease, but more responsive to HIV, not just HIV, more responsive to epidemics. So this policy that we're working on, the Ministers of Health of CARICOM agreed in the caucus of last weekend to allow us to work on it and to present it finished to them for the next caucus of ministers in 2011, around this time. So we are working hard on it and expect that we will have a closely finished product in April when we have our chief medical officers meeting next year. The exciting thing about using primary health care as a platform for combating the issues that affect our health systems is that we get it at the prevention level. We get it at the point where most people interface with the health services. And we minimize how it affects persons if we can get it early. So we're quite excited about this new aspect. And I wanted to use this whole issue of health system strengthening to talk about the role that PAHO has played in assisting Barbados in pandemic preparedness. We wrote our plans, and the PAHO team came down and helped us some years ago in refining the plans and making them national, not just health sector plans. And then when we were faced with the mother of all tests last year, the H1N1 pandemic, PAHO's role in laboratory strengthening has been critical. Through CAREC, we were able to strengthen our public health laboratory so that we could test several different influenza viruses. And that strengthening has now extended to strengthening that will allow us to do confirmatory testing in the future in that public health laboratory. I'm quite excited about that development, so I wish to thank PAHO